Question 1. The nurse on a surgical unit is caring for a client who is recovering from a modified radical mastectomy. Which one of the following nursing interventions is appropriate for this client? C. Avoid taking BP using arm on surgical side. The nurse should avoid taking a blood pressure using the arm on the surgical side. Blood draws and needle sticks should also be avoided. The goal is to reduce the risk of lymphedema. The client should also be instructed to avoid constriction of the arm by wearing tight clothing or jewelry, or carrying a heavy handbag on the operative side. Modified radical mastectomy and NBSB, removal of the breast, most of the lymph nodes under the arm, and often the lining over the chest muscles. The arm should be above heart level to promote drainage. The JP, Jackson-Pratt, suction drain, or the drain placed by the surgeon, should be emptied at least every 8 hours, or more often if needed. Strengthening exercises are not started until weeks 4 to 6. The client receives passive ROM exercises. Question 2. A 17-year-old client with type 1 diabetes is admitted following a urinary tract infection. Results of arterial blood gases are pH 7.2, PaO 290, PaCO 245, and HCO 316. The nurse knows these ABG results indicate. B. Metabolic acidosis. Diabetic ketoacidosis can occur following an infection, such as pneumonia or a UTI. Because insulin isn't present to process glucose, the body breaks down fat, resulting in circulating ketones, which are acidic. Metabolic acidosis is indicated by a low pH and HCO3. Respiratory alkalosis is determined by elevated pH and low PaCO2. Respiratory acidosis is determined by low pH and elevated PaCO2. Metabolic alkalosis is determined by elevated pH and HCO3. Question 3. The nurse is reviewing the laboratory results of a client with a diagnosis of congestive heart failure. The client takes furosemide 20 mg PO bid. Which laboratory result should be reported to the healthcare provider, HCP, immediately? C. Potassium 3.2 MEqL. The nurse should notify the HCP immediately of the potassium level of 3.2 MEqL. Even a slight decrease below normal values increases the risk of arrhythmias and death. Normal electrolyte values: sodium, Na, 136 to 144 MEqL or mol/L, potassium, K, 3.7 to 5.1 MEqL or mol/L, calcium, Ca, 8.5 to 10.2 mg/dL, chloride, Cl 95 to 105 MEqL or mol/L. Question 4. The nurse is instructing parents on how to care for their 3-year-old child with a new diagnosis of Wilms tumor. One of the parents asks why they shouldn't press on the child's abdomen or be careful when bathing the child. What is the nurse's best response? C. It's important to keep the tumor intact. Wilms tumor, also called nephroblastoma, is the most common form of kidney cancer in children. The tumor expands the renal parenchyma, and the capsule of the kidney becomes stretched over the surface of the tumor. Parents and caregivers should be instructed to never and NBSB, palpate and NBSB, the abdomen of a child with and NBSB, Wilms and NBSB, tumor, as this increases the risk of rupturing the encapsulated and NBSB tumor, which could cause cancer cells to spread to other areas of the body. Wilms tumor is usually not painful. If there is pain, it is from the rapid growth of the tumor. High blood pressure is triggered when the tumor blocks the blood supply to the kidney. Constipation is a possible complication, not diarrhea. Question 5. When educating a client prior to a paracentesis procedure, which statement is correct? C. You'll need to empty your bladder before the procedure. Paracentesis and NBSB is a procedure in which a needle or catheter is inserted into the peritoneal cavity to obtain ascitic fluid for diagnostic or therapeutic purposes. And NBSB, the bladder should be empty to avoid perforation and allow easy removal of the fluid. There is no need to remain on the right side post-procedure, as there is with a liver biopsy. Although the client may be instructed to be NPO, it's not necessary. Hypertension, not hypertension, is a risk post-procedure. Question 6. An experienced RN is observing a new graduate nurse perform dressing changes with transparent film. Which dressing change will cause the experienced RN to intervene? B. Applying the film to a third-degree burn. Transparent film dressing has a porous adhesive layer that lets oxygen pass through to the wound and moisture vapor escape from the wound. Transparent film dressings are indicated for partial thickness wounds, stage I and stage II pressure ulcers, superficial burns, and donor sites. A transparent film dressing can also be used as a secondary dressing to cover or secure a primary dressing. Transparent film dressings are not used on third-degree burns. Advantages of transparent film dressings: it's easy to visualize the wound, the dressing doesn't have to be removed when you examine the wound. The dressing's flexible shape allows use at elbows, knees, etc. Transparent film is impermeable to external fluid and bacteria, promotes autolytic debridement, and prevents or reduces friction. Disadvantages of transparent film dressings: they may stick to some wounds and cause pain when removed. Also, most transparent dressings don't absorb moisture and aren't indicated for draining wounds. Question 7. A client comes to the outpatient center to be evaluated for pneumonia. Which of the following tests will most likely be used for a diagnosis? A. Chest X-ray and complete blood count. The most common diagnostic tests for pneumonia are a chest X-ray and a complete blood count, CBC. Pulse oximetry may also be part of the testing. If further testing is indicated, it can include an arterial blood gas, ABG, a sputum smear or a blood culture to determine the pathogen. Lung biopsy and bronchoscopy are not generally performed for diagnosis of pneumonia. Question 8. EMS transports a client who was rescued from a house fire to the emergency department. The client is awake and alert. Because of smoke inhalation, the client is placed on a non-rebreather mask at 15 liters per minute, 15 liters per minute. What concentration of oxygen, O2, is the client receiving? B. 80 to 100%. Non-rebreather masks are used to deliver oxygen therapy in emergency situations to clients who require high concentration oxygen but are able to breathe on their own. A non-rebreather mask is a face mask that covers both the nose and mouth. It has two one-way valves. One valve is between the face mask and a plastic reservoir bag, typically 1 liter, that connects to a supply of oxygen. No exhaled air or outside air can enter the bag, so only oxygen flows from the bag to the mask. The other valve allows exhaled air to flow into the atmosphere but doesn't allow the outside air to enter. It is called non-rebreather because the client is unable to inhale anything they exhale. Only pure oxygen is inhaled. A non-rebreather mask typically delivers 80 to 100% oxygen at a flow rate of 10 to 15 liters minute, L-minute. Question 9. The nurse is preparing a client for a liver biopsy. Which instruction regarding the procedure is correct? B. The client will be placed on the right side after the procedure. Following a routine liver biopsy, the client is placed on the right side to minimize bleeding. All other options are incorrect. Question 10. A father brings his 2-year-old son to the emergency department after finding him next to an empty bottle of aspirin. The child is unconscious but breathing. What will be the nurse's first action? C. Insert a nasogastric tube, NGT, to prepare for lavage. In an overdose situation, the first action is to get rid of the toxin by emesis or lavage. Because the boy is unconscious, lavage is the only option. Overdose of aspirin, salicylates, can cause respiratory failure, but the child is breathing. Family services authorities are not part of immediate resuscitation efforts, and education is inappropriate at this time. Question 11. After the nurse assists a provider with a PICC line insertion, which test must be performed first? A. Chest X-ray. PICC, peripherally inserted central catheter, is a type of central line that can be in place for an extended time and used for infusions that can't be administered by a standard peripheral 4. It is inserted into a peripheral arm vein and rests in the distal superior vena cava or cavo-atrial junction. The other options are not related to confirming PICC line placement. Question 12. A 7-year-old boy is admitted for a tonsillectomy on the morning of the surgery. He has never been hospitalized, so he and his parents appear anxious. What is the nurse's most therapeutic action? B. Spend time with the child and his parents to explain what will happen. The nurse should prepare the child and parents for any procedure by taking time to explain what will happen and what to expect. Don't try to diminish their anxiety by offering vague explanations or waiting until the child is no longer present. What is a routine procedure for the nurse can be a source of fear and anxiety for the family. Question 13. EMS transports a trauma victim who is exsanguinating. The provider orders rapid blood transfusions to treat hemorrhagic shock. A potential complication of this type of blood administration is B. Hypocalcemia. Massive transfusion, MT, is a life-saving treatment for hemorrhagic shock, but it can be associated with significant complications. The lethal triad of acidosis, hypothermia, and coagulopathy associated with MT is associated with a high mortality rate. Other complications include hypothermia, acid-base derangements, electrolyte abnormalities, hypocalcemia, hypomagnesemia, hypokalemia, citrate toxicity, and transfusion-associated acute lung injury. The potential for hypocalcemia among patients receiving large amounts of donated blood products over a short period is due to the presence of the anticoagulant citrate in the bag in which donated blood is collected. Each unit of packed red cells for transfusion contains approximately 3 gm citrate, which binds with serum calcium and serum magnesium. Question 14. A client who is 22 weeks pregnant tells the nurse at the OB clinic that she's always tired and sometimes feels lightheaded. Her H&H show HGB is 10 GDL and HCT is 32%. The nurse determines that the client's diet is adequate and her weight gain is normal. What will likely be the diagnosis? A. Iron deficiency anemia. Anemia is present in the second trimester if the hemoglobin level is below 10.5 and the hematocrit value is below 35%. The recommended hemoglobin level during pregnancy is 12 to 16 GDL. Any value below 12 is considered iron deficiency, and any value below 10.5 is considered anemia. Without iron supplementation, iron deficiency anemia occurs in many pregnant women because their iron stores need to serve their own increased blood volume as well as be a source of hemoglobin for the growing fetus. This client will need increased iron and monitoring during future visits to the OB clinic. Question 15. Following birth, the infant of a mother with type 1 diabetes is transferred to the newborn nursery. What nursing action is most important for the nurse to perform? A. Check the infant's blood glucose level. An infant of a diabetic mother, IDM, is more likely to have periods of low blood sugar, hypoglycemia, shortly after birth, and during first few days of life. This is because the neonate has been used to getting more sugar than needed from the mother. An IDM is also at risk for a high bilirubin level, newborn jaundice, and may require phototherapy, but that is not the first action. Respiratory distress is a risk for an IDM, so the infant should be monitored closely, but automatic O2 supplement is not indicated. Birth weight of an GT, for 1000 gm, 8.8 pounds, is common, and will likely have been determined prior to birth. Question 16. A client with a diagnosis of congestive heart failure, CHF, is taking digoxin, lanoxin, 0.25 mg per qd, daily, and furosemide, Lasix, 20 mg per bid. Which is the most important laboratory test result for the nurse to monitor? B. Potassium. Furosemide, Lasix, is a non-potassium-sparing loop diuretic. Hypokalemia is a common side effect of furosemide and may enhance digoxin toxicity. While it may affect the excretion rates of all electrolytes, hypokalemia can cause ventricular arrhythmias and sudden cardiac death. Question 17. Parents bring their 2-month-old to the clinic for a routine checkup. The baby is being bottle-fed and is tolerating the formula well. The nurse instructs the parents not to prop the bottle during feedings. Besides the risk of choking, it also puts the infant at risk for A. Otitis media. Propping a bottle puts a baby at risk for otitis media. In infants, the eustachian tube is short and straight. If formula pools at the back of the throat, it can enter the middle ear, allowing bacteria to also enter and cause an ear infection. Candidiasis, thrush, and tonsillitis are not related to bottle feeding. Conjunctivitis is an eye infection. Question 18. To reduce the risk of transmission of infection, which item of personal protective equipment, PPE, does the nurse don first? B. Gown. According to the CDC, the proper sequence for donning PPE is 1. Gown, 2. Mask, 3. Goggles, 4. Gloves. For remembering the sequence, a popular mnemonic is to don the items from the bottom up, with your hands over your head. Question 19. EMS transports a client who called 911 with complaints of chest pain. Which action should the nurse do first? B. Obtain a full set of vital signs. The nurse should start by getting a full set of vital signs to provide basic information to the providers. The other actions are related but can be performed after the initial rapid assessment. Question 20. A client with post-traumatic stress disorder, PTSD, works for a company with 10 employees. The client asks a nurse if the Americans with Disabilities Act, ADA, can make the client's employer provide reasonable accommodations for the client. The nurse knows that. B. The client's company is exempt because it is small. The ADA states, reasonable accommodations include making existing facilities accessible, job restructuring, part-time or modified work schedules, acquiring or modifying equipment, changing tests, training materials, or policies, and providing qualified readers or interpreters. Possible accommodations for PTSD include altered break and work schedules, e.g., scheduling work around therapy appointments, quiet office space or devices that create a quiet work environment, and changes in supervisory methods, e.g., written instructions from a supervisor who usually does not provide them. The ADA covers companies with more than 15 employees. Question 21. When entering the staff break room, the nurse overhears another nurse sharing personal information about a patient's medical history. What is the nurse's best action? C. State your discomfort about sharing private information. HIPAA regulations are very clear on protecting private information. Every healthcare professional is responsible for maintaining confidentiality. The nurse should address the group directly in a non-threatening way. I don't feel comfortable listening to a patient's private information being shared. Question 22. During which stage of general anesthesia does the client have no protective gag or cough reflex? C. Surgical anesthesia. The 4 stages of general anesthesia are: Stage 1, induction, the start of analgesia. The client starts to lose consciousness but is not yet amnesiac. Stage 2, excitement, irregular respirations and cardiac rhythm, uncontrollable muscular activity, and potential vomiting. This stage is minimized as much as possible. Stage 3, surgical anesthesia. The client is totally unconscious. Dilated pupils, complete muscle relaxation, and no protective gag, laryngeal, or cough reflexes. Stage 4, emergence, a return to the pre-anesthesia state. The client may become agitated and confused. Tachycardia, blood pressure changes, and shivering may occur. Question 23. At shift report, the ICU nurse assumes care of a patient who was diagnosed with respiratory acidosis. At the next scheduled arterial blood gas, ABG, which result would indicate that the patient is still acidotic? A. pH 7.25. A pH of 7.25 is acidotic and requires intervention. A pH of 7.38 or 7.42 is within normal limits. A pH of 7.48 is alkalotic. Question 24. In the proper sequence for removing personal protective equipment, PPE, which item is removed last? B. Mask. According to the CDC, the proper sequence for doffing PPE is 1. Gloves, 2. Goggles, 3. Gown, 4. Mask. An easy way to remember this sequence is to just go alphabetically. Question 25. To obtain an accurate blood pressure reading, the client must do which of the following? A. Hold the arm at heart level. National and international guidelines offer specific instructions for measuring blood pressure. And NBSB, preparation for the reading, the position of the arm, and other factors can change a blood pressure reading by 10% or more. For the most accurate reading, 1. Avoid caffeine or tobacco for 30 minutes before the reading. 2. Sit quietly for 5 minutes before starting. 3. Don't talk. 4. Sit in a chair with feet on the floor and your arm supported so your elbow, bent at 90 degrees, is at heart level. Question 26. The nurse is preparing a client for an exercise stress test, stress ECG, to assess for a possible cardiovascular diagnosis. If the client asks the nurse what the purpose of the test is, what is the nurse's best response? C. When you exercise, your heart requires more oxygen. A stress ECG, stress testing, raises myocardial and peripheral needs for oxygen, therefore evaluating the ability of the heart and coronary vessels to keep up with the additional demand for O2. The purpose is not to provide a baseline. It causes an increase in O2 demands beyond daily activities. Monitoring is performed but not for developing cardiac conditioning. Question 27. Which is the most appropriate position for a client admitted with increased intracranial pressure, ICP? A. Head of bed, HOB. At 30 degrees, head in neutral position. The nurse must be careful to prevent an elevation of the ICP. The head of the bed, HOB, should not be above 30 degrees, and the head should be maintained in a neutral position. The other positions can increase ICP by impeding cerebrospinal fluid drainage. Question 28. The nurse is taking the medical history of a client being admitted for surgery. The client tells the nurse that they are worried about the possibility of malignant hypothermia. The nurse knows that this complication of general anesthesia is caused by an A. Autosomal dominant inheritance. When given general anesthesia, people at risk of malignant hypothermia may experience a rapid increase in heart rate, hypothermia, abnormally fast breathing, muscle rigidity, breakdown of muscle fibers, rhabdomyolysis, and increased acid levels in the blood and other tissues, acidosis. Without prompt treatment and cessation of the drugs, the body's reaction can cause multiple organs to be unable to function, including the heart, cardiac arrest, and kidneys, renal failure, and it can cause disseminated intravascular coagulation, DIC. MH is a severe reaction to particular anesthetic drugs that are often used during surgery and other invasive procedures. Specifically, this reaction occurs in response to some gases administered for general anesthesia. Malignant hypothermia susceptibility is inherited in an autosomal dominant pattern, which means one copy of the altered gene in each cell is sufficient to increase the risk. Question 29. On arriving for his shift, Nurse Tom notices that Nurse Mary smells of alcohol and her speech is slurred. What should Nurse Tom do? B. Report his observation to the charge nurse. Patient care must never be compromised. Nurse Tom should immediately report his observations and concerns to a supervisor. Nurse Tom should not try to handle the situation himself or assist Nurse Mary throughout the shift. An incident report is inappropriate. Question 30. Each of the 3 Glasgow Coma scale components has a certain number of steps, plus a non-testable NT option. Which of the following is the correct combination of steps? B. Eyes 4, verbal 5, motor 6. Starting at the top of the head, eyes have 4 steps, verbal, mouth, has 5 steps, and motor, arms and legs, has 6 steps. Eye opening, spontaneous equals 4, to sound equals 3, to pressure equals 2, no opening at any time equals 1. Verbal response, oriented to name, place, and date equals 5, confused but can communicate equals 4, intelligible single words equals 3, sounds or moans equals 2, no audible response equals 1. Motor response, obeys commands equals 6, brings head above clavicle when head or neck stimulated equals 5, bends arm at elbow with normal flexion equals 4, bends arm at elbow with abnormal flexion equals 3, extends arm at elbow equals 2, no movement of arms legs equals 1. Question 31. During Mental Health Awareness Week, a local television station asks to do a story with the inpatient unit's nurse manager. As the crew films the interview in the dayroom, clients are seen in the background. What violation did the nurse manager commit? B. Disregarding the HIPAA right to privacy rule. HIPAA protects a client's right to privacy, so permitting clients to be recorded, even in the background, is a violation. Question 32. A client presents to the emergency department, complaining of crushing chest pain that radiates down his left arm. He appears diaphoretic and short of breath. The nurse suspects these are clinical manifestations of A. Myocardial infarction. This client has clinical manifestations of a myocardial infarction, crushing chest pain or pressure, pain in the arm, back, or jaw that lasts more than a few minutes, sweating, shortness of breath, nausea or vomiting, and anxiety. A cough may or may not be present. Bacterial pneumonia is indicated by a stabbing chest pain that worsens when coughing or breathing, a cough with thick yellow or green mucus, and a fever of 102 to 105 degrees Fahrenheit. A spontaneous pneumothorax is indicated by chest pain that may be more severe on one side, pain on inhalation, cyanosis of the skin or lips, rapid breathing, and tachycardia. Pericardial effusion signs and symptoms include chest pain behind the sternum or on the left side, dyspnea, orthopnea, a feeling that the chest is full, and edema of the legs or abdomen. Question 33. The nurse uses the Glasgow Coma scale, GCS, to assess a client with a head injury. What total score will the nurse assign with the following observations? Eyes open when the client is spoken to, the client is disoriented, but can speak coherently, and the client exhibits abnormal flexion at the elbow. A. 10. For this client, the Glasgow Coma scale, GCS, is 10. The score is written as the sum of the scores, as well as the individual elements. For example, a score of 10 might be expressed as GCS 10 equals E3V4M3. Eye opening when spoken or shouted to equals 3, verbal response of disoriented but able to speak coherently equals 4, abnormal flexion at the elbow equals 3. Head injury classification, severe head injury, GCS score of 8 or less, moderate head injury, GCS score of 9 to 12, mild head injury, GCS score of 13 to 15, source, Advanced Trauma Life Support, Course for Physicians, American College of Surgeons, 1993. Question 34. Following a total abdominal hysterectomy, the client asks the nurse what to expect after their postoperative recovery. What is the nurse's best response? D. You will be placed on estrogen replacement medication. A total hysterectomy is the surgical removal of the uterus and ovaries. Surgical menopause occurs when both ovaries are removed, oophorectomy, no matter the age of the woman having surgery. The ovaries are the main source of estrogen production in females. Menstrual periods stop after a hysterectomy. When uterus and ovaries are removed, menopause begins. Most women who've had total hysterectomies have reported improved or unchanged sexual function after recovery from surgery. The client will be placed on estrogen-only hormone replacement therapy after surgery, which does not increase breast cancer risk. Visits with a gynecologist continue for pelvic exams, pap smears, and HPV testing. Question 35. A client with a known history of chronic obstructive pulmonary disease, COPD, presents to the emergency department with increasing shortness of breath. Arterial blood gas results on room air are pH 7.30, PaO2 55 mm of mercury, PaCO2 60 mm of mercury, HCO 326 MEqL. The nurse knows these results indicate D. Uncompensated respiratory acidosis. Uncompensated equals the pH is outside of normal ranges. That is, the body's buffer system is yet to, or has failed to, bring pH back within normal ranges. Respiratory acidosis equals lungs can't remove enough of the carbon dioxide, CO2, produced by the body. Excess CO2 causes the pH of blood and other bodily fluids to decrease, making them too acidic. In uncompensated respiratory acidosis, the pH level is decreased, the PaCO2 level is increased, and the HCO3 level is normal. In a client with long-standing COPD, the HCO3 level will gradually rise over time to compensate for the gradually increasing PaCO2, and the person's pH level will be normal. Note, this client's ABGs reflect right heart failure, with PaCO2 and GT, 45 mm of mercury and PaO2 and ILT, 60 mm of mercury. Normal ABG values, no COPD, are pH 7.35 to 7.45, PaO2 75 to 100 mm of mercury, PaCO2 35 to 45 mm of mercury, HCO3 22 to 26 MEQL. Question 36. A 19-year-old female presents to the OB clinic for her first prenatal visit at 32 weeks gestation. She is gravida 2, para 0, AB1, with a history of drug and alcohol use and smoking 1 ppd. The ultrasound shows poor fetal growth. What is the likely cause for the abnormal result? D. The mother's lifestyle habits. Smoking, illicit drugs, and as few as 1 alcoholic drink a day are linked to poor fetal growth and low birth weight. A young adult age is not necessarily a risk for pregnancy. Previous abortions, whether spontaneous or induced, are not related to this pregnancy. And while early prenatal care is important, it is not the cause of this ultrasound result. Question 37. The maternity nurse is educating a new mother about caring for her 2-day-old son's circumcision. Which of the following statements by the mother would indicate a need for further instruction? D. Applying alcohol daily will keep the site clean. Rubbing alcohol should not be used, it would be extremely painful. The mother should continue to observe the site until it is completely covered with clean, pink granulation tissue, which will take about 7 to 10 days. Applying a petroleum-based ointment, such as Vaseline, to the site after each diaper change will provide a barrier. Acetaminophen, such as Tylenol, can be administered for signs of discomfort. Question 38. On Thursday, January 1st, following a motor vehicle crash, EMS transports a male named Robert to the emergency department. The nurse asks the client to state his name, where he is, and the date. Robert answers, Robert, hospital, December. What verbal response score on the Glasgow Coma scale does the nurse assign? D. Confused equals 4. If the client is unable to answer at least one question, such as the current month, correctly for whatever reason, they should be rated as confused. Even though it is the first day of a new month, the highest response observed by the nurse is confused, so the score is 4. Question 39. Following a fall from a ladder, a patient is admitted to the ICU with a diagnosis of traumatic brain injury, TBI. The nurse observes that he is increasingly restless and has developed weakness in his right arm. He is also complaining of nausea. What is the nurse's best immediate action? D. Elevate the head of the bed to 30 degrees. The patient's symptoms indicate an increase in intracranial pressure, ICP. The best immediate action for the nurse is to relieve the ICP by elevating the head of the bed to 30 degrees. Oxygen therapy will not decrease ICP. Increasing the flow can be harmful. Taking the patient's blood pressure is not an immediate action, but it can be done before contacting the physician about the patient's change in status. Question 40. 7 months after birth, an infant is diagnosed with a persistent patent foramen ovale, PFO. The parents ask the nurse what this means. The nurse explains that before the infant was born, the purpose of the foramen ovale was to bypass D. The pulmonary system. In fetal circulation, the foramen ovale shunts some blood from the right atrium to the left atrium, bypassing the pulmonary system. From the left atrium, blood goes to the left ventricle. Since the fetus receives oxygen from the maternal circulation, the hepatic circulation and superior vena cava are unaffected. Normally, about 75% of foramen ovale seal completely within a few months after birth. If the foramen ovale does not, it's called a patent foramen ovale, PFO. Most PFOs require no treatment. Question 41. While performing post-op ambulation, a client's chest tube is accidentally pulled out. What is the nurse's first action? D. Apply pressure to the insertion site. A and NBSB, chest tube falling and NBSB, out and NBSB, is an emergency. Immediately apply pressure to the chest tube insertion site, and apply sterile gauze or place a sterile Gelinette gauze and dry dressing over the insertion site and ensure a tight seal. Apply the dressing when the patient exhales. If patient goes into respiratory distress, call a code. Notify the provider to reinsert a new chest tube drainage system. Coughing and deep breathing can cause further harm. Reinsertion of the chest tube is a medical procedure, not a nursing procedure. Assessing the need for replacement is a medical decision, not a nursing decision. Question 42. Following a car versus pedestrian accident, the 49-year-old pedestrian is transported to the emergency department. The ED physician diagnoses internal bleeding and a fractured femur. Surgery is indicated, and the nurse attempts to contact the next of kin for consent. What is the proper order for authorizing consent for this client? D. Spouse, adult child, parent, sibling. The correct legal sequence for obtaining consent is spouse, adult child, parent, sibling. In the event of life-saving or emergency surgery, consent can be waived under the doctrine of necessity. Question 43. A home health nurse observes that a client with amyotrophic lateral sclerosis, ALS, has developed dysphagia. What is the nurse's immediate concern? D. The client is at risk for aspiration. Dysphagia is an inability to swallow properly. A client who develops dysphagia is at risk for aspiration, which can lead to choking or aspiration pneumonia. Difficulty speaking is called dysphasia. Clients with ALS often drool. While drooling is inconvenient and embarrassing for the client, it is not an immediate concern. Mouth infections may develop if oral hygiene is poor, but this is not an immediate concern either. Question 44. A 52-year-old client with a 30-year history of alcohol abuse has been diagnosed with cirrhosis of the liver and esophageal varices. To avoid rupturing the varices, which should the client avoid? D. Becoming constipated. Valsalva maneuvers, straining at stool, vomiting, and coughing can increase intrathoracic and variceal pressure. Weight loss can improve a fatty liver and reduce risk. Acetaminophen, Tylenol, is preferred over NSAIDs such as ibuprofen. The client should follow the provider's orders. Moderate to vigorous exercise should be avoided, but walking is beneficial for well-being. Question 45. According to GCS-40, the most recent Glasgow Coma scale, which of the following is not a site or method for physical stimulation? D. Sternal rub. GCS-40 now instructs clinicians to apply pressure in 3 specific locations as needed, to note the increasing intensity required to elicit a response. Start with pressure to the fingertips, then move to the trapezius muscle and finally the supraorbital notch if needed. A sternal rub is not recommended, because it can cause soft tissue damage and the responses to it are unpredictable and unreliable. Question 46. Which laboratory test is the priority for a client who presents to the emergency department with symptoms of unstable angina? D. Troponin. The most commonly ordered and cardiac-specific of the cardiac biomarkers. Blood levels of troponin will be elevated within a few hours of heart damage and remain elevated for up to 2 weeks. Troponin tests are usually ordered initially in the ED when a client presents with symptoms of unstable angina. And NBSB, myoglobin, is a protein released when the heart or skeletal muscle is injured. Serum potassium level is related to cardiac arrhythmias. Creatine kinase, CK, levels will double over 24 hours with a myocardial infarction. However, because levels of CK can go up in many other conditions besides a heart attack, it is not very specific. Question 47. EMS transports a young client who sustained a gunshot wound to the head in a drive-by shooting. On arrival to the emergency department, which assessment should the nurse do first? D. Airway. Assessment of a head injury can follow the ATE algorithm: A equals airway, B equals breathing, C equals circulation, D equals disability neuro, using the Glasgow Coma scale. E equals exposure, lacerations, facial fractures, depressed skull fractures, basal skull fractures, battle sign, clear discharge from nose or ear, or obvious penetrating injury. With any head injury, always consider the cervical spine. It may require immobilization before starting the assessment. Question 48. A 15-year-old girl takes an overdose of Tylenol after her boyfriend breaks up with her. Then she immediately calls 911. On admit to the emergency department, the nurse prepares the client for gastric lavage. What position will the client be placed in? D. Left lateral, with head lowered 15 degrees. Gastric lavage is a gastrointestinal decontamination technique that aims to empty the stomach of toxic substances by the sequential administration and aspiration of small volumes of fluid through a large bore orogastric tube, 36 to 40 fr. The client is placed in a left lateral position so that ingested substances can collect in the stomach and passage into the small intestine will be slowed. To be effective, the procedure should be done within 1 hour of ingestion. Question 49. Which of the following statements about the Glasgow Coma Scale, GCS, is false? D. The GCS can be used effectively only on adults and children over age 10. The GCS can be applied to children over 5 years old, because they can speak, answer questions, and follow directions. Originally developed in 1974 by professors at the University of Glasgow, Scotland, the GCS has been adopted by over 60 countries and translated into 40 languages to help clinicians assess and document the level of consciousness in patients with head trauma. Question 50. Clients with chronic obstructive pulmonary disease, COPD, often lose weight, related to poor appetite. Which action best promotes better nutrition? D. Practice oral hygiene before and after meals. Because clients with COPD are often mouth breathers, oral hygiene before and after meals helps remove mouth odor and the stale taste of sputum and provides a sense of well-being. Milk products contribute to thick sputum and should be avoided. Exercise can tire the client, leading to lack of hunger. Fluids should be encouraged to increase and thin secretions.